Another way to use the nebulizer is with an attachment that looks like this. And basically you would attach it the same way, put a little bit of pressure and maybe twist it a little bit so that it's securely fastened to the compartment that holds the medication. And then I'll show you how this is used with Autumn. Again, walk around here. Okay, Autumn. This part's going to go in your mouth. Okay? So you're going to breathe in and out. And you do want to instruct your child to take deep, full breaths. There you go. And as you can see with the mist coming in and out, it's clearly going inside of Autumn's lungs. And that's where the medication needs to go. Now it's going to be a little more challenging for her to be able to read a book. She could watch TV, of course, or do some other activities. But again, this might be something that might be helpful for a child that doesn't, like to have that mask on their face. There are also other ways, here, let me take it out, that you can use this. If you turn it around and you actually have something that seals this right up here, and then, nope, just breathe it in, honey. And then they just breathe it in like that. And that might be more, this is actually what we used with my son when he was still a baby, because he wasn't going to hold something in his mouth and he wasn't going to be able to use a mask either. So you could put like some plastic around here and a rubber band and just seal it off, and then they can breathe it in on that side. As long as they're getting the medication in their lungs, that's what's important.